Good evening, everyone. I welcome you all to the session today. Today we are conducting Pragnavaridhi lecture series. We have Vaidya Nagaraj sir. Sir will be teaching about Nidra, Swapna, Ojas and special senses. Before that, I'll give brief introduction about Panchajanya. Panchajanya, the divine coach of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing the culture, accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma, hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, and its values to all strata of people in every corner of world. Also, the founders being Ayurveda aspirants, now the inside out of today's life medical field. Hence, they aim to make people aware of this and also try their best to resolve this on the go. In order for all this to be achieved, we have set up various wings with working principles and objectives that help achieve the goals faster and easier in the coming years. They are Team Swami Vivekananda, Team Ashwins, Team Veda Vyasa, Team Sanjaya and Nalanda. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation aiming at working together and bringing forward the true essence of Bharat and her traditions. So, all those who fit under these categories are welcome with honor and privilege. In this session, today we have Vaidya Nagaraj Kamath sir, presently working as Associate Professor and Assistant Head in the Department of Kriyashareera and Dean Innovation and Skill Development at SDM Hassan. Sir has presented more than 30 papers in national and international seminars. Sir has more than 135 research and review article publications to his credit in various national, international Ayurveda medical journals as first author. Sir is an editorial board member of different international Ayurvedic medical journals. Sir has delivered more than 50 guest lectures in different Ayurvedic colleges in online and offline mode. Sir also has authored more than 23 books. Awards and records. Sir has gained Virendra Hegdeji Padabhisheka Award and Jivaka Award from the Academic Excellence. Asia Book of Awards and India Book of Records for the highest number of publications in different fields of Ayurveda in the period of 1 year, 10 months. Kalam's Vajra Book of World Records holder and International Book of World Record holder for authoring world's first detailed Android app on Ayurvedic physiology, Kriyas Parsham. Best Teacher of 2021 at SDM Ayur Guru 2022 by SDM Hassan. We are very glad to have you in this session today, sir. And now you can start the session, sir. Over to you, sir.
Okay. Thank you, organizers, for a detailed introduction of mine and even giving me an opportunity to speak on the topics. Hope my voice is audible.
Yes, sir. Audible, sir.
Okay, thank you so much. So let us start with the first topic, that is Nidra, which all of us like. Okay, so which is very much essential to maintain the physiology. And I can proudly say that this Nidra as well as Swapna, these two presentations are done under my guidance by my PG scholars, Dr. Spurti as well as Dr. Bhuvana. So anyway, so these are the contents. First of all, let us understand what are the contents to be included under the topic Nidra. Because even if academic point of view, if you see for exams, then it may come, Nidra may come for 5 marks where you have to write 3 pages of info. So to fill up with that particular point of view, as per current syllabus, so this much points can be included in your answers. So number one being the introduction. then derivation, which we say has how the word is being derived. Sanskrit term utpatti. After that, paryaya, that is synonyms, and actually physiology of nidra, that is how nidra occurs. That is nidra utpatti, and then bheda of nidra, that is types, and benefits of the nidra, its importance, and finally the most important, that is clinical significance. So these are the points which we are going to see, and you have to consider in the topic of nidra. So next point, in the introduction, first of all, we have to see that all the presentation, it should not be in the paragraphs or sentences form. Try to make in a nice flowchart form, so that it will be attractive also, and who is evaluating the paper, he also will be of a thought, that notion that yeah, this person knows. So the introduction to this topic is our acharyas have graded the level of consciousness in four categories. We can say it as a grading, where Jagrata Avastha means a fully awake state. The second one is Swapna Avastha, where a person is in the stage of dream. And the third one is the Shushupta Avastha, that is the stage of actual sleep. We can say superficial sleep. And Turiya Avastha, that is the stage of deep sleep. So this sentence in the form of flowchart, this particular point in the form of flowchart, will become the first point under introduction. So the next slide, if you see, then you have the point which is mentioned by Yoga Ratnakara, where he mentions that there are four basic natural instincts, okay, or desires of every human being. They are food, water, sexual desire, and last and foremost and very important is sleep. That is Nidra. So this becomes the second introduction point. And the third one is, you can categorize the full day into two. Okay, has a day means ahoratra, we can say. So aho means day, which is for the activity, and ratra or ratri, it is for the rest. That is, rest is nothing but in the form of nidra. And the total ahoratri, which we say that it is 24 hours, as per our classics, it is around 30 muhurta. So this 3 points becomes the introduction aspect of the nidra. So the next, we will move on to the second heading, that is derivation. That is how this particular word is being derived. That is utpatti, you can say. So when you consider with the utpatti of the word nidra, it is from the Amarakosha, where he say that the nidra word is derived from following letters. That is ni, dra, rak, and ta. So ni plus dra plus rak plus ta, nidra ta. From this word, each letters, this particular word, nidra, is being derived. And simple meaning is of this particular term is encapsulation of consciousness. Or you can say temporary encapsulation of the consciousness. Consciousness is temporarily encapsulated. So this is the meaning of the this particular derivation. So only one point is, you should remember the letters and reference. Usually you can see that almost it may be nidra or swapna. Both the derivation is from the Amarakosha. Okay, and meaning, that is encapsulation of consciousness. So this is the second point. Then the third point is, when you consider with the synonyms, that is paryaya, then you get the following synonyms. It may be shayanam, swapaha, swapnaha, samaveshaha, and two more important synonyms are there. That is Vaishnavi Maya and Bhutadhatri. Vaishnavi Maya, the term is being given because it is said to be under the control of Lord Vishnu, and Bhutadhatri means it refers to that, Bhuta means here all living beings, and Dhatri means nurturing or nourishing. So Nidra is that particular entity which nourishes all the living beings. So like this, you can remember the synonyms. Next point is the actual Nidra Utpatti. Here you have different, acharyas, points, but here mainly what shloka you have to by heart is of Charaka Samhita. So which goes like yatatu manasi klante karmatmanah klamanvitaha vishebhyo nivartante tada swapati manavaha. So here Charaka Samhita, he says that when manas gets klanta and body also gets exhausted and even atma gets exhausted, we say no, that the total sharira is nothing but the combination of sharira, sattva, and atma. It is considered as three danda. So Sharira, Sattva, Atma, all these three when gets klama means exhausted, then the person enters the stage of sleep. How the indriyas will not be able to contact with the respective sense organs. Then the person enters the stage of sleep. So if you want to make a sequence out of this, it means that mind, body, and soul gets exhausted, as a result of which sensory organs will not be able to perceive the respective sensory objects. Then the person goes to sleep. So in the next slide you can see the the same flow chart. That is, mind, body, and soul get exhausted, sense organs becomes inactive, as a result of which person enters the stage of sleep, that is Nidra. So this is Charaka's opinion. When you consider with Shushruta's opinion, Shushruta says, first opens up with the statement that Hridayam Chetana Sthanam. So Hridaya is that particular organ where Chetana is located. Organ, it gets covered up by the tamas. Okay, it gets covered up by the tamas, and then the person goes to the Nidra. Later on, even he says that it's not only you have to consider with the manasika or manodosha, you have to even consider sharirika dosha. So sleshma and tamas together, okay, in conglomeration, it causes nidra. And for nidra, main if in entity responsible is tamas, and for jagaruka means for waking up, the main entity that is responsible is sattva. So this is what Sushruta opines. In this, we have to understand that how physiologically we have to relate, because here it is not that hridaya refers to, it always refers to heart. Here you have to consider prefix, maybe uro hridaya or shiro hridaya also. When you consider with the shiro hridaya, then there is something called as cortical inhibition because of continuous activity, okay, which is excitatory. Okay, suddenly inhibition starts in one particular area, and that inhibition spreads throughout the brain, as a result of which the person sleeps. So this can be correlated with this particular concept for the better understanding. Rather than by hearting the concept, understand the concepts. Fine. So this is how Sushruta's opinion. Then Vagbhata's opinion. Here he says that the srotas will be getting accumulated with the shleshma or the kapha, as a result of which the contact between the manas and the indriya is being lost, because maybe physical activity or mental activity due to shrama, sharirika shrama it may be, or manasika shrama. So sharirika shrama and manasika shrama, okay, and because of nature, in the ratri kapha has to increase, because of which srotas will be accumulated with this leshma. Because of these two reasons, manas and indriya contact is lost, as a result of which person goes to sleep. So this is Vagbhata's opinion. And last one, that is Harita, the next slide, where he tells that there is something called as Nidra Pradurbhava Sthana. Means you can say sleeping center, like that you can translate. So Nidra Pradurbhava Sthana, he says that it is Bhrumadhya, in between the eyebrows. He tells the surface anatomy. Means, in between the eyebrows, if you go, in depth, okay, then you can get the pineal gland as well as the pituitary gland. So pineal gland, it is mainly responsible for the sleep cycle. So when that gets avarana by the tamas, then, a person goes to sleep. So this is what is Harita's opinion. So all four opinions you should understand, and main one is Charaka's opinion, where you have to even by heart with the shloka. So the next point here comes is, after the Nidra Utpatti is the types of the Nidra. So there is no mandate that you have to by heart the shloka with regards to the types. Mainly you should know the names according to different acharyas. So next slide, where I have mentioned about the least as per Charaka. So these are the types of Nidra he tells. So totally 7 types of Nidra are there, where first one is tamobhava, which is you can consider as predominance of tamas. You can say that the person is in coma, so like that, which he will not be giving response at all. So that is what is considered as tamobhava, stage of coma, like that you have to remember. Then shleshma samudbhava, because of increased shleshma. And the third and the fourth, you can differentiate manaha shrama and sharira shrama, because of physical exhaustion and because of mental exhaustion. Both, whatever nidra you get, that is to be considered. Then the fifth one is agantuki, because of some trauma. If there is road traffic accident or any kind of injuries, etc., then the person enters the stage of unconsciousness. So that is to be considered because of external trauma, not of the disease, but of the external trauma. Whereas of the disease is the sixth variety, vyadhyanuvartini. You are having fever, you are having high grade fever, you get tired and you prefer to sleep. So that is to be considered here as Vyadhyanuvartini. And the last one being Ratri Swabhava Prabhavaja Nidra, because of Swabhava of the Ratri and its influence. So Ratri Swabhava and Prabhava. Okay, Swabhava means it is the nature and its influence. Prabhava, a that which is nothing but the physiological Nidra, that is to be understood here. So this is what Charaka says. One is totally very severe stage, that is Tamobhava, that is the stage of coma where you have to consider, and Sleshma Samudbhava because of increased Sleshma. So Tamas and Sleshma, these two you have to remember together. Then Sharira Shrama and Manashrama, this you have to remember together. And diseases, you know, it is Nija and Agantuki, correct? So Agantuki because of external trauma and Nija is Vyadhyanuvartini. So like that you have to remember. And last one is physiological, that is Ratri Swabhava Prabhava. So like this, if you remember, then you will be able to recollect all the types of Nidra as per Charaka. So the next slide, where according to Sushruta is very clear and very simple. He says that the nidra is of three types. Either totally tamas, means totally patient is totally unconscious. That particular part can be considered, or swabhavaja, which is physiological and pathological because of different diseases. So, but whatever the physiological is there, he has categorized it into three sections. Either the dominancy of sattva, if sattva is dominant, then he will sleep only in the midnight. And it is swabhava of him. You can't say it is pathological. You can't say that he is having nidra nasha or nidra alpata. And one more person is there who is having wavering sleeping pattern. So that is rajo bhuista. And some person is always nidralu. Okay, so that is tamo bhuista. So here we have to understand tamasi refers to total unconscious or coma stage, and tamo bhuista is coming under physiological. Okay, which is little bit of excessive nature. His nature is to be always having a sleepy. Okay, so that particular part is to be considered. So this is the dimension as per Shushruta. He says only three types and categorizes Swabhaviki again into three, depending upon the Manoguna, that is Sattva, Raja, and Tamas. Okay, so next slide, where you have the most important point. This shloka is mandatory. Examiner also expects that this shloka is to be by hearted. So nidrayatam sukham dukkam pusti karshyam balabalam vrashta klibata jnanam ajnanam jivitam nacha. So these are considered as the benefits of the nidra. Means you can say it has the both, because whenever we consider pros and cons. So if you are having a proper nidra, then you will get sukha. Sukha here it doesn't mean happiness as such. Okay, if in many of the textbooks you get happiness, here also the same is mentioned, but if you go into the deeper meaning, it refers to health. Sukha sangnikam arogyam vikaro dukkam evacha. So dukkha is vikara avastha, sukha is arogya avastha. So sukha refers to healthy stage, and dukkha refers to disease state. So if nidra is proper, you are going to get sukha, that is health. Pusti means nourishment. You are going to get bala, that is strength. You are going to get vrishata, means aphrodisiac. Okay, and jnana, that is knowledge. So these are the positive part when you are having proper nidra. If by any reason, maybe deliberately or because of your work pressure or any whatsoever, if nidra is not proper, then it leads to following problems. That is, it may lead to dukkha, that is vikara, illness. It may lead to karshya, that is emaciation. It may leads to abala, loss of strength. And it may leads to klibata, less maybe impotency, or we can say, or fertility related problems, infertility, like that you can consider. And ajnana, okay, ignorance. So this is what. And last point, jivitam nacha. If you are having proper nidra, you will have a proper lifespan. Whereas if you are having improper nidra, it will going to definitely negatively influence your lifespan or ayu itself. So these are the, you can make two tables where you can tell about the positive points and the negative points depending upon the nidra. So like this you can mention the meaning of this shloka in the form of nice table as positives and negatives. That's it. Okay, merits and demerits. So next one comes is the importance. So most important is nidra is said to be as a dharaniya vega. So whenever you get nidra, you should sleep. So this is what our acharyas mentioned. And as I told earlier, that nidra is also called as bhuta dhatre. It nourishes all the living beings. That also to be considered. And the third point is, it is said, Shushruta says that it is a swabhavika roga. Okay, he categorizes certain diseases and certain diseases, okay, under swabhavika roga. It means it is natural. For example, hunger, kshut, trut, jara, mrityu, okay, nidra pravartaya, like this he says. So hunger it may be, thirst it may be, or else aging it may be, death, and even nidra. All this comes under Swabhavika Roga. This is what he says. So Swabhavika Rogadalli, in that Swabhavika Roga, you have one particular point, that is Nidra is also coming under this particular category. So these 3 points. After that, the next one, here you have to consider with regards to the clinical significance. It is very clear that clinical significance, whenever you talk about Nidra, then you have to categorize it, right? That either it is less or it is more. That is why it is clinical. If it is proper, it is not of clinical significance. Applied physiology, it's not. So applied physiology or clinical significance, it comes either Nidra is more or Nidra is less. So considering this particular aspect, you can consider, insomnia, whatever we speak of in the modern. In Ayurveda, you get two terms for it. That is Alpanidra or Anidra. So whenever we consider this particular aspects, we can consider two reasons for this. Either it may be the Sharirika reasons or else it may be the Manasika reasons. So whenever you consider the Sharirika reasons which are being mentioned here, it may be Vata Vriddhi. Vata Vriddhi most commonly it leads to Nidra, or else Pitta Vriddhi also. Vata Vriddhi leads to Nidra Nasha, total loss, whereas Pitta Vriddhi leads to Nidra Alpata, okay, less sleep. So that also may be cause, okay, or else Abhighata, external trauma. You are having a severe leg injury, you are having ligament strain, you can't sleep. Snayugata Vata, you will not get sleep. So that is one of the reasons. And Kafakshaya also, maybe. So this is considered as the Sharirika reasons. Whereas, Manasika also, you can consider, that, Manasika Abhighata is there. If somebody, in your home is dead, you can't sleep. So that particular mano abhighata to be considered is abhighata in the, whatever is mentioned in the green part, it is telling about the manas. So that is to be considered, or else even tama, okay, tamak shaya is there, rajo vriddhi is there, and masthapa, some kind of mental disturbances or mental stress. All this leads to alpa nidra or anidra. So this is a general knowledge. On that basis, you can write this particular aspect. So the next slide is also very similar, where you have atinidra. Similar things you have to mention in opposite way, where we told about Vata Vriddhi leads to Atinya, Anidra. Here you have to tell Vata Kshaya leads to, Atinidra, and there we have told about Kapha Kshaya. Here you have to tell about Kapha Vriddhi or Kapha Prakopa. And even Rasa Vriddhi and Tamo Vriddhi also leads to Atinidra. So this is how we are, dealing. And if you are interested, you can even mention about certain sleep disorders. How you have epilepsy is also possible. Means out of nowhere, the person is driving car, out of nowhere he gets bouts of sleep. So that is called as narcolepsy. Some tumor in the brain, it causes this particular thing. You are going to study detail in the further years. And sleep apnea, okay, means respiratory arrest during sleep. Sleepwalking, somnambulism, this is also more common. And disturbed sleeps, parasomnia, hypersomnia, insomnia, etc. These are the sleep disorders which you can consider. So, I think these are the points which you have to consider under the topic of next slide, please. So this completes with the topic of Nidra. So totally you have the following points which you have to consider. Okay, it may be starting with the introduction, and then later on with each of the aspects you have to consider. So next most interesting topic, that is Swapna, that is the world of dreams. So whenever we consider with the concept of Nidra and Swapna, same pattern it goes. Means Swapna also, it may come for 5 marks. That is a short essay. Definitely all the topics it may be attracted for MCQs also. But when you consider the topic wise, Nidra and Swapna, it may come together. The physiology of sleep and dreams as per Ayurveda as a long essay, or else it may come as a physiology of Nidra as per Ayurveda, physiology of Swapna as per Ayurveda separate for a 5 mark question in paper one. So paper two, sorry. So next one, when you consider with the contents of the Swapna, next slide, please, where you have these contents. Okay, so you have always remember that introduction, always introduced to the topic. Okay, and then you have Utpatti and Nirukti, that is derivation as well as definition. And then the physiology of dreams, that is Swapna Utpatti, how Swapna occurs. And then you have classification of Swapna, that is Bheda of the Swapna. Then Swapna and its relations with the Prakriti and about dreams. So these are the contents. So let us go first with the introduction. So here you have to write again 3 points. The first point is it is a unique quality of a human being where he can seize the Swapna. That is most important aspect. After that, everybody, each and everybody experiences Swapna during the sleep. This is a common general knowledge sentences which you can include in the introduction. Okay, and most important point is it may be our acharyas or else even the current day scholars. They want to deeply analyze and interpret the swapna, because there are some good omens, some bad omens, we say, which depend upon the dreams. So there is a need to analyze and interpret the total concept of this particular swapna. So these are the three introduction points. It is a unique quality. Everyone experiences this particular swapna and in sleep. And last one is acharyas or else our scholars, they want to understand and interpret this particular swapnas. Means research, it is having much scope for research. So the next point here comes is how this particular word is being derived. So as you know that Nidra and Swapna word are synonymous. But in this particular context, we are not talking Swapna as a Nidra, means sleep. We are considering Swapna as a Swapna, means as a dream. So when you consider with derivation, Utpatti, then it says that Swaponan. Okay, you can say that Swapaha means you can say it is numbness or it is a stage of inactivity. Okay, so that is what it means with regards to the derivation, how the word is being derived, Utpatti. So Utpatti as per Amarakosha, it is Swaponan, which simply means it is a stage of inactiveness. Whereas when you consider with the definition, once again from Amarakosha, where he say that Swapnaha Swape Prasuptasya Vijnane Darshane Puma. Okay, means he says that Swapna is that particular stage. Prasuptasya means the stage, the person is in the stage of sleep. During this, he gets Vijnana. Vijnana means Vishesha Jnana, some kind of knowledge he gets. And even he sees Darshane. Woman means it is not having any gender, but humans. So humans in the stage of sleep, he will be getting special kind of knowledge, and even he sees some things. That is considered as Swapna. So this is how you should define Swapna. So both of the things, that is Utpatti and Nirukti, is mandatory. And the next point comes here is the physiology of Swapna. That is Nati Prasuptaha Purusha. Here some technical grammatical mistakes are there. You just go to the Samhita in Charaka Indriya Sthana and note the correct shloka. So Nati Prasuptaha Purusha Safalan Afalanapi Indriyeshena Manasa Swapnaha Pashyati tu Anekada. Means the person is not in the deep sleep. He is in the superficial sleep. Nati Prasuptaha Purushaha. Okay. Then what? Safalan Afalan Afi. Means he sees two kinds of swapna. Safala swapna or afala swapna. It may come true, it may not be coming true. Or else other meaning may be it is good dream or bad dream. Both can be considered. Okay. Indriyeshena manasa. During this particular, whenever the person is not in the deep sleep, okay, Indriyeshena manasa means manas will try to contact with the indriyas. Swapnan pashyati to anakada, because of which he will be seeing different types of swapna. So a person who is not in the stage of deep sleep at this time, Manas will try to contact with Indriyas and he sees dreams. And the dreams, here only he classifies into two. Either it is Safala, which is going to come true, or Nafala, which is not going to come true. So the next one important is the Swapna Utpatti, where you have a different the above one is also Swapna Utpatti, that you can consider as physiological one, whereas here you can consider pathological, where the three doshas which are getting accumulated, okay, because of pragnapara, the different reasons, it is going to obstruct the manovahasrotis, as a result of which the indriyartha sannikarsha, the contact between indriyartha and manas, it is being lost, as a result of which, or else it became hampered, not complete, as a result of which the person enters to the stage of sleep. So that is the meaning. So next point will after the Swapnotpatti is the classification. So these are the basic dimensions by which Swapna can be classified. Means one basis on the source and content of the dream. It may be on the basis of efficacy, or it may be on the basis of effect, or else depending upon the person who sees the dream and the utility. As per the utility also it can be classified. So the first one, let us see, that is as per the source. So there is no need to by heart this particular shloka. Okay, let us move on to the next slide. One more, next slide, please. So this particular thing will give a clear cut as per Charaka's opinion that what are the types of swapna. Drishtaha. It is better that to create an impression. Okay, you look onto this particular table again and again so that you will get a clear cut picture and you by heart in the same order. because even in Viva also it is the expectation is like you are well versed, you are skilled enough. So whenever it is being asked to tell me types of Swapna as per Charaka, Drishtashtuta Anubhuta Prarthita Kalpita Bhavika Doshija. So this order is being expected. So here also, Drishta, if you go for as per the meaning, it is visual dreams. You see something. Shruta means auditory dreams where you hear the voices. Then the Anubhuta means you will experience many things. It may be pain, or else it may be happiness. There you are experiencing happiness in your bed you are sleeping. There you are getting some pain in the dream. Here you are having that particular expression in your face. So that is Anubhuta. Even in children's and all, you can see that they will be sleeping in deep, at that particular time suddenly they will have some movements change in the expression, etc., etc. They may cry, they may be smiling. So all those things that you can consider as Anubhuta, which is being experienced. Then Prarthita means whatever you expect, your expectation in real life, okay, that will be fulfilled in the dreams. So for example, you want iPhone, okay, in real life, in dream you will be seeing that you yourself with the iPhone. So that is what is considered as Prarthita. Okay. Then is Kalpita means you yourself self created. You are creating a scenario of dream. So next one is Bhavika. It is said to be an omen. It may be a good or a bad, so which is going to relate it to your future. So that particular category. And doshaja, because of doshic influence, you are going to get the detailed of it. You are going to study in Indriya Sthana of Charaka in Roganidana. So this is Charaka's opinion. The next one is as per efficacy, we can consider that it is afala or safala or falavan, means which is having a positive impact, which is not having a positive impact. That is to be considered as per the efficacy. And as per the effect, good dreams and bad dreams, as I said, Shubha and Ashubha. Shubha is good dreams and Ashubha is bad dreams. So the next type variety. Next slide, please. So here you are going to get, as per the person who sees. The person may see himself in the dream, or else he may not see himself, but he will see many other people. So this is what one more type you can categorize. And finally, utility, where Swapna is being utilized. For example, it may be utilized to analyze the Prakriti, because Vata Prakriti always sees the confusing and irritative dreams. Pitta Prakriti sees adventurous and horrifying dreams. That's Jyotisham. Jyoti is nothing but adventure and horrifying. Akashachari means it is confusing and irritable dreams. Whereas Kafaja, here it is, Jalashaya Loki, we say. So it is nothing but happy and comforting dreams. So this is the utility. It means Swapna is utilized to analyze the Prakriti. And the sex of the fetus also can be understood. Okay, or depending upon the Swapna that pregnant lady sees. So that is again one more benefit of the Swapna. And even Vyadhi also can be analyzed. This you are going to understand in Roganidhana. That also can be understood. And even Graha influence, because of different graha, because we say that Ayurveda is Ashtanga. So Kaya Bala Graha. So influence of Graha also is to be considered here. So because of different influences of Graha, they may be seeing certain kinds of dreams. You can't say specific, but of that variety. So that also is one of the utility. We can say that if this type of dream is seen, maybe this Graha Bada. So like that, it will be helping us to judge. That's it. So the next one here comes as according to Doshik dominance, very clear, that is Vataja, Pittaja, and Kafaja. And Sharangadaracharya, Harita Samhita has given with certain, categories, means when he sees the dream and duration of the result. We say, that early morning, whichever dream is seen, it will become true. So it will become very true early, Anta. That's what he means to say. So he says that if you are seeing dream in the first part of the night, it may come true within 1 year. And second part of the night, if you are seeing any dreams, it may come true within 6 months. And third part of the night, whatever dreams you see, it will come true. It will become true within 3 months. And fourth part of the night, that is, you can say the last part, okay, or early morning, it will come true very soon, within 10 days. And he says that the dream which is seen during rainy season, etc., okay, or in the daytime, it will come true within 6 months. Again, much more research to be done in this particular aspect. This is what you are getting in Samhita, and we can consider it as the Aptopadesha. But one more point I want to tell here is that majority of the sapna we don't remember. Only very few percentage, grossly you can say around 2 to 10% maximum. If you see the range, we remember total life. In total life, 2 to 10% of the sapnas only we will remember. Rest we don't remember it. So we can't, judge on that particular basis as such. But whatsoever, this is what is a opinion of the acharyas to be considered. Next one. So this is very clear. Next slide. Swapna and Prakriti. Okay, yeah, we have studied Sharangdara Shloka, Alpakesho Krusho Ruksha. In that, very clear that Vata Prakriti Akashachari. It doesn't mean that Akashachari means he is always sees himself flying in the sky. No, it's not the meaning. Human beings can't fly. Correct? It creates a confusion. It creates irritation. You don't love yourself flying. It is so irritating. Okay, then the normal. So that's what Vata Prakriti is always. Dreams will be always impact of the dream. You can say that अरे यार क्या हुआ, confusion or irritation. Pitta Prakriti dreams, Jyotisham Dishwa, those Jyoti means fire. So that kind of dreams, adventurous and horrifying. You are hitting somebody, or 10 people are coming and you are fighting with them, or horror dreams. You are seeing some ghost, etc., etc., which increases the metabolism in the body. So that particular impact is adventurous and horrifying. And the last one, kapha, which you see, jalashaya aluki means more comforting, more happy. It is individualistic. For some, it may be like 1 month vacation. It is this particular news is very happy, so they see such dreams. So that is happy dreams. That is kafaja dreams. You see one full plate of sweets for another person. Okay, that is happy for him. It is so comforting for him. So that is kafaja dreams. So this is how you have to categorize the swapna as per different prakriti and analyze it. That's it. If you consider Akashachari, Jyotisham, and one more, that is Jalashaya Loki, such dreams nobody sees. We have to understand the meaning, that is Arthapati, what they want to tell by telling Akashachari, Jyotisham, and Jalashaya. That's what I want to convey. So these are the points to be covered in the topic of Swapna. So both the slides, that is, it may be Nidra or even Swapna. The effort is being done by our my PG scholars to make this particular slides very beautiful. Recently, we have covered the topic for one batch of undergraduates. Okay, so I felt that the slides are very attractive and colorful, so that it will be helping you also. So I have used the same slides. I want to give credits to them also. So let us move on to the next one, that is Ojas. So let us move to the first slide. Here, first one we are understanding. Ojas is a very important topic. It is the topic attracts for 10 marks. Okay, so for the long essay, and definitely MCQs also, and sometimes even short essay may be asked. So finally, it is up to the call of the students that which and all headings they will include. So when you consider first, as we have discussed earlier, we should know how the word is being derived. So these are the two definitions which you get from Amarakosha. That is Urjateva Ubjateva iti. Urjate means the one which gives energy, and Ubjate means one which keeps the body upright. So that is a meaning, which gives energy and which keeps the body upright. That is Ojas. So this is one meaning. And the next one is Urjaha Bala Pranayoho, means it is that particular entity which gives energy to the Bala as well as the Prana, or it is responsible for that. Okay, so that is to be considered as Ojas. So the next slide, when you consider with the definition and Utpatti, okay, it is up to the call of the students that whether you can by heart the first shloka, that rasadinam shukrantanam dhatunam yatparam tejaha sa kalu ojaha. Okay, or else the second one is also fine. Ojastu tejo dhatunam shukrantanam param smritam. The famous shloka that is from the Ashtanga opening shloka. So Ojastu tejo dhatunam shukrantanam param smritam. The meaning is very simple. That is, Ojas is the purest essence of all the seven dhatus. Okay, that's it. Okay. So the next point, when you consider with the Ojas, we have finished with the Utpatti. Okay, and we have finished with the Nirukti, that is definition. Now, how the Ojas is getting nourished, Poshana of the Ojas. This shloka, no, this particular shloka, if you by heart, you can put it for all the Saptadhatus and Ojas. Okay, Pushyanti to Ahara Rasat, and you write all the Saptadhatus in order. Rasa, Rudira, Mamsa, Meda, Asti, Majja, Shukra, Ojamsi. Very easy shloka. Okay, so the Poshana of all the Saptadhatus, including Ojas also, is by Ahara Rasa. That is the meaning. So this is the third heading which you can write, Poshana of the Ojas. So the next one, we'll consider about the Guna of Ojas. Definitely, when you consider with the Guna of Ojas, you have different shlokas. Even you can take Ashtanga Hridaya shloka, even you can take Charaka shloka. Okay, but here shloka of Shruta is, I feel that it's to be easy, because if you see the first line, all the words, it starts with S, letter S. Somatmakaha, Snigdaha, Shuklaha, Shitaha, Stiraha, Saraha. So all are yes, yes, yes. Okay. Then the three one you have to remember Vivikta Mrudu Mrasna VMM. Okay, and last one is Pranayatana Uttama. It is the Shrestha Pranayatana. It is a very vital entity in the body. So and all these meanings are very very easy. That is Somatmaka. It is a cooling in nature. Okay, Snigdha. It is unctuous. Shukla. It is white. Okay, Shita. It is cold. Sthira and Sara. Sthira means it is referring to the Paraojas, which we are going to discuss in the next, which is always to be stable, and Sara means always mobile, which is referring to the upper ojas, which is always moving throughout the body. It is having both the qualities, Sira and Sara both. Okay, and Vivikta, it refers to that it is very pure. And Mruduhu, it refers to that it is very soft. And last one, that is Mrisna, you can consider that it is slimy. So and it is a Shrestha Pranayatana. It is very vital entity in the body. So this is about the guna of ojas as per Shushruta. Next slide, where this also can be understood as per Charaka. Okay, that is Guruhu, Shita, Mrudush, Lakshna. Okay, Balam, Stiram, Maduram, Stiram, Prasannam, Pichilam, Snigdam, Oja, Dasha, Gunah, Smritam. You can mention, not no need to by heart the shloka, but you can tell that after Shushruta shloka, Acharya Charaka has mentioned 10 gunas, 10 gunas for ojas, and then if whichever you can enlist that. Okay, as per your convenience. Next one, where you have most important, that is the karma of ojas. Okay, these are the karma. Whenever ojas is in proper state, then sarva cheshtasu apratigatah, means all bodily functions will be functioning properly. Sthira upachita mamsata, your mamsa will be more sthira, more stable and well nourished. Upachita. Swara varna prasadaha, swara and varna both, that is voice as well as the complexion, it will be very much proper. Okay, then okay, bahya and abhyantara karana, atma karya pratipattir bhavati. It may be jnanendriya, it may be karmendriya or ubhayendriya. All 11 indriyas will do its own karya. Atma karya pratipatti means it will be doing its own karya. That's what it means. Okay, so this is what you have to understand with the karma of ojas. Next one, where this particular shloka which all the students consider, that is ojastu tejo jatonam shukrantanam param spritam hridayastham api vapi dehasthiti nibandhanam. Okay, it is the essence of all the saptadhatus. Even though it is present in the hridaya, it is responsible for hridayastham api dehasthiti, it is responsible for maintaining the sthiti of the deha, means it maintains, it keeps the body upright, it keeps the body proper functioning. That is the meaning of this particular shloka. Next one, where you have the classification of ojas. That is, ojas can be classified into two as per this one classics. That is para ojas and apara ojas. Next one, where you have the difference between para and apara ojas. Okay, so para ojas, the origin is intrauterine life, whereas apara ojas, it is derived from the saptadhatus. Okay, and the pramana of the ojas, para ojas, it is astabindu, and apara ojas, it is ardhanjali pramana. And when you consider with the varna of the ojas, then para ojas is said to be sarpa varna and sarpi varna, sorry, and apara ojas, it is raktam ishat sapitakam. Okay, slight red and yellow mixed, so like that kind of. And taste, it is said by our classics, which mentions to the apara ojas, that is madura rasa, and odor also laja gandhi, it is signifying with apara ojas. And location, that is para ojas, it is located in the hridaya, whereas apara ojas, it is located in the sarva sharira. And lastly, effect wise, if any para ojas is getting affected, then definitely or kshaya happens or any abnormality happens, then it leads to marana. Whereas any kshaya with the apara ojas happens, then it leads to vyadhi. So this is what we have to understand. Whenever, see, para ojas, how it is being formed in the intrauterine life. So whenever shukra shonita sanyoga happens, shonita, it is agneya. It does the paka of the total component, as a result of which sara and kitta is formed. So sara is the garbha and the kitta is the ojas. Okay, so that is to be considered, that how this para ojas is formed. And that para ojas, whenever in the fourth month, okay, in the garbha hridaya is being formed and the lady becomes dhauridaya. Okay, that time this ojas enters into the heart and stays there. Okay, that is why it is said as pradhana, because it holds the atma or that particular energy within. So whenever shukra shonita sanyoga happens, sara formed is garbha and Kitta formed is Ojas, and this Ojas holds the Atma inside the Garbha, that is the Kalala Rupa. That is why it is Pradhana, and that is the Ojas which enters the Hridaya. That is why it is called as Para Ojas. Para Ojas is said as Para Ojas because it is Pradhana. Apara Ojas, it doesn't mean it is apradhana. Compared to para Ojas, it is apradhana. That's it. Okay. So next one more reference you are going to get. That is, it may be rasatmaka Ojas, Jiva Shonita Rupi Ojas, Dhatu Tejo Rupi Ojas, and Shleshmatmaka Ojas. If you want to direct get understanding, rasatmaka Ojas, it may be immunoglobulins or WBC. Jiva Shonita Rupi Ojas means it can be considered as antigens which are there in the RBCs and other components, protein components. And Dhatu Tejo Rupi refers to tissue phagocytes. In each and every tissues you have phagocytes. Okay. And Shleshmatmaka Rupi Ojas means all the mucous membrane. It may be conjunctiva, it may be mucus of the nasal cavity, oral cavity, or even skin. See, whenever we talk about Ojas, the first point comes to us is Ojas means immunity. Okay, so how it is to be considered that whatever we spoke till now, where is the relation of immunity with it? So this is what most of the people what they think is this are considered as the synonyms of the Ojas, but they are not. They are the dimensions of the Ojas. Okay, रसानां तथा जीवशोणिते ओके धातूनां तेजसी रसे तथा जीवशोणिते प्राकृत श्लेष्म चैव Ashtanga mentions this. So that is what we have to consider in different dimensions with regards to Ojas. Next one. Uh, anyway, so this one we have understood that is a prakritastu balam sleshma mikruto malam uchyate. Okay, search a voja. So prakrita sleshma. Okay, this is shloka is being expected by majority of the teachers when ojas comes. So prakrita sleshma you can consider it as bala, and that is nothing but ojas. Whenever the vikruta of the sleshma happens, then it is mala or papma. That is a simple understanding. Next one. So this and all, if you want, you can refer into because in the slides I have included many of the points. Okay, if you want, you can remember that this particular points. It may be siratva sandhibandha kshamadibhi because prakrita sleshma is nothing but ojas, right? So you can write the functions of the sleshma also. So which is tiratva stigdhatva sandhibandha kshama that is being mentioned here, and even of the Charaka's opinion, what are the functions of the sleshma. And whenever we consider about the ojas, we consider the concept of Vyadik Shamatva. And we say that nurture sarvani sharirani Vyadik Shamatve samarthani bhavanti. Individualistic. It is not standardization, but it is a concept of individualization by Ayurveda, where it is says that one person to person immunity is going to vary, which we have seen earlier, even in the times of the corona. Correct? If you 10 people goes and have ice cream in this rainy season, maybe one or two may get cold because they are having less immunity. Others may not have that particular orientation or inclination towards getting cold. Okay, so that is what we have to understand with this particular aspect. Next one. So anyways, Vyadik Shamatva means what? Okay, that is Vyadi Bala Virodhitvam. Okay, totally opposing. Okay, the strength of the Vyadi and Vyadi Utpadaka Pratibandhakatvam Titi means even in the formation of Vyadi also it should oppose. Okay, strength of the Vyadi is being opposed and it is opposing the formation of the all, preventing the Vyadi itself. So that is to be considered. Okay, with regards to Vyadik Shamatva. So this is not as such to be included in between. Okay, after karma of the ojas, everything classifications etc. We can go for ojo vikaras and then also you can mention about Vyadik Shamatva. It is finally call of the student that whether to include Vyadik Shamatva at the in this particular context or can mention it at the end also. Even with the Balavritikara Bhavas, which we are going to see in the next. Okay, that is next. So all these things. Okay, it is if you want, you can include this. Otherwise, all the other matters, whatever we have discussed till now, and even Ojo Vikara matter also, that covers almost all the concepts of Ojas as far as exam point of view is concerned. Okay, next slide, please. So we have to consider about Ojo Dosha or Ojo Vikaras, where Sushruta mentions this concept. That is, Ojo Vikaras are of three types, he says. That is Visramsa, Vyapat, and Kshaya. Okay, there is no need to by heart any shloka, but you can remember, you can make a chart of it. That is Ojo Vikara, three types in the form of flowchart, Visramsa, Vyapat, and Kshaya. Okay, next one, individually we have to understand that what is this Visramsa? It is says that Visramsa refers to Sthanat Chutihi. Now we say that here whatever, see, one more point I want to say here is Ojo Vikara, whatever Sushruta has mentioned, that is he has categorized as Visramsa, Vyapat and Kshaya. It is for Apara Ojas. The categorization is for Apara Ojas, not for Para Ojas. Para Ojas Vikara, only and only leads to Marana. Okay, that we have discussed. So here the Apara Ojas Vikaras are being mentioned as Visramsa, Vyapat and Kshaya. So Visramsa is said as Tanat Chutihi, means Apara Ojas leaves his sthana and goes to the other sthana. So when you see the sthana of Apara Ojas, it is Sarva Sharira, correct? Then how can you say sthana chutihi? Means here, because of some trauma, along with the blood, along with the rakta, Ojas also goes out. That is Apara Ojas which goes out. Okay, that is to be considered. That is why you see the definition Visram Saha Sthanat Chutihi Abhigata Adibireva. Whenever there is any trauma, then there are chances that Apara Ojas, which was circulating throughout the body, it may come out along with the Rakta. That is the meaning. So, whenever any kind of trauma, road traffic accidents, RTA happens, then what you see? Sandhi Visleshaha, looseness of the joints or dislocation, Gatranam Sadanam, full body pain or body weakness, Doshachavanam means displacement of the doshas from its states, means abnormal functioning of the doshas. Kriya Sannirodhascha, day to day activities is being obstructed. And all these things you see whenever there is any kind of trauma, road traffic accidents, along with the blood, Apara is going out, and these are the Lakshanas that you see. To understand it easily and then list, this picture you have to remember. Next one is Ojo Vyapat. Okay, where he says that Dushta Dosha Dushya Samsargat. First of all, because of your apatya ahara and vihara, dosha gets vitiated. The vitiated doshas affect the dhatus, and that affected dhatus is going to affect the ojas. Because you know that ojas is the essence of the dhatus, correct? So, because of which the following symptoms are seen. That is stabda guru gatrata. There may be stabdata and guruta of the gatra. Stabdata means, it is stiffness, and guruta means kind of heaviness of the total gatra. And vata shofa means swelling because of vata, gaseous distension or such sort. Okay, even in sandhivata you see swellings, correct, of the joints with some crepitus. So that can be considered vata shofa. Then varna bheda, there will be change in the color of the skin. Okay, loss of complexion or discoloration. Okay, glanihi. Okay, and you know that a kind of exhaustion, tandra, stupor, and nidra, sleep. So these are the ojo vyapat lakshanas. And definitely visramsa, vyapat, and kshaya, all three shloka is being expected by the examiners. Okay, better to buy. And kshaya very simple, swapramanat, where we say that a Paravajas Pramana is Ardhanjali, quantity wise it is being reduced. Okay, and here when we consider, Aparavajas, okay, I want to quote my teacher in undergraduation, Dr. G. Srinivas Acharya sir, who was ex-principal of SDM Udupi. He simply says that Ojas, if you consider in one dimension, it is nothing but glucose. Whatever you take the nutrition, finally it ends up in glucose. And you see the Ojakshaya Lakshanas. Whenever there is decrease in the glucose, we say hypoglycemia, then what you see, the patient will be unconscious, murcha, mamsakshayaha, means body will become very thin and lean. That you see in diabetes, no? Or whenever there is hypoglycemia, the same thing you see, mohaha, altered consciousness, pralapaha, irrelevant speech. And even if there is hypoglycemia is more, it may affect the brain and the person may die, maranamiti. So this simulates, whatever the Ojakshaya Lakshanas are told, it almost simulates with hypoglycemia, severe hypoglycemia. Okay, especially in those who are having no insulin dependent diabetes mellitus, where they have not taken food or taken very high dose of insulin, as a result of which there is severe hypoglycemia. Okay, in hospitals you can see hypoglycemic patients, they do come with all these features. And in this time, if we give 25% dextrose immediately, then everything their functioning will become normal. If their brain is not affected, that hypoglycemia is not affected the brain, any part of the brain, then everything will be fine. So this particular aspect, it is better to understand. Fine. So the next one, definitely, when you consider with one more opinion, okay, he says that what happens in Ojakshaya. Vibeti durbalo bhikshnam dhyadiri vetitendriya duchayo durmano ruksho bhavekshamasya tashay. Even the same shloka you get it in Astanga Hridaya, which is the students' favorite shloka, and most of them they by heart this particular shloka itself. Whenever there is ojakshaya, okay, viveti durbalo abhikshna, okay, there will be a loss of confidence, fear, okay, then durbalaha, constant, this one, and dhyati vititendriyaha, continuously thinking on some concept, some worry, etc., tension, we can say, and vititendriyaha, okay, discomfort in all the sense organs, duchayaha, loss of complexion, durmanaha, even the mind also will not be, clear, and rukshata will be dominant, okay, and he will become kshamaha, okay, means you can say emaciated, okay. So these are the lakshanas which Charaka has mentioned, and even Ashtangridaya has mentioned about ojakshaya, okay. Next one. If you want, even you can remember all those things, okay. What are the reasons for ojakshaya, which is mentioned by Ashtangridaya, okay. Ojah kshiyate kopah kshudyana shoka shamadhibihi. Kopa, excessive anger, okay. Kshut, okay, excessive hunger, okay. Then dhyana means, it doesn't means meditation also, but continuous grief, continuous worry, okay, dhyana, okay. And even shoka, okay, kind of mental trauma, okay, worry, okay. And shramadibhihi, okay. Shrama here, it refers to both sharirika shrama, it may be, or else even manasika shrama, it may be. That is to be considered as a reason for ojakshay, okay. Next one. So this is how we have to understand with the concept of ojas. You have to start with the derivation. Okay, two simple shlokas are there. After that, you have to understand what is ojas. That is ojas to tejo dhatunam shukrantanam param smritam. That particular point of view. And then, as per the sequence, you can go for guna, sthana, karma, and then you can go for veda also. And finally, ojo vikaras you can mention, where you have to mention about visramsa, vyapat, and kshaya. And finally, you can mention about Vyadik Shamatva also. And to if a person is having lower Vyadik Shamatva, how to improvise that particular Vyadik Shamatva. Okay, by taking Bala Vriddhikara Bhavas, that can also be noted. So since it is not coming totally under the perspective of Ojas, I have not mentioned in detail about the Vyadik Shamatva, or else has Bala Vriddhikara Bhavas also, only confined to this particular point. So the three topics which is given to me, the Ayurveda topics, I have finished it. Okay, so I request that all of you, that you go through these particular points. Okay, it becomes easier. Even I have shared the the PPTs to the organizers. The same PPTs you can utilize. You can make a notes, because one point every of your teacher also might have said. Even my teachers also have said that 10 times reading. Okay, more than that, one time writing. Okay, so one time writing is equal to 10 times reading. So whenever you read any concepts, just write it, so that it is a practice which makes the things from a short term memory to long term memory, it stores. Okay, that is one particular point. And as I told you, Nidra, it is responsible for jnana. Again, that it is a tactics. That is, you read certain topic and take a power nap of around 10 minutes. So what happens is, from this, it triggers that whatever whatever you have studied, okay, it gets stored in the long term memory. Okay, so these are the techniques by which you can convert the short term memory into long term. Okay, fine. So let us go on to the most important topic of the nervous system. Okay, so these are the slides which I did it earlier. I am utilizing the same now. So let us go for the understanding of the sense organs. Four sense organs we are going to understand. So in that, the first one we will see is olfactory sense. So olfactory sense, these are the points which you have to cover. First, you should know what description about olfactory mucosa. Then you should know about the physiology of olfaction, means what happens at the level of the nose. Okay, and finally, from the nose, how it is taken to the brain, that is olfactory pathway. And simple applied physiology, two to three terms are there that you should know. So these are the 4 points to be understood in olfactory sense. So whenever you consider with the first point, that is olfactory mucosa, so where it is located? It is located in the roof of the nose, superior aspect of the nasal cavity. Okay, that is the location of olfactory mucosa. Next point, what does it contain? It contains three types of cells. Okay, so previous slide, please. Yeah, in this you can understand that three types of cells are there. Number one, is the receptor cell, which receives the impulses and takes to the brain. That is one. The word itself is very clear: receptor cell. The next one is the supporting or sustentacular cells, means which gives the anatomical support as well as the physiological support to the receptor cell. Okay, and the third one is the stem cells, means if there is any injury, then there are chances that stem cell gets converted into receptor cell, but it is going to take lot and lots of time. Okay, so three types of cells they are present: receptor cell, supporting cell, and stem cells. And the location is olfactory mucosa, roof of the nose. Next one, where you understand the physiology of the olfaction. So whatever the smell that comes, odorant substances, it may be in the form of chemicals, volatile principles, whatsoever. Okay, it is that particular odorant substances. It is going to bind to the specific receptor protein which is there in the membrane of the receptor cell. Okay, so that you can have to imagine that the particular chemical you are put a spray. So that particular molecule it goes into the nasal cavity and it binds to the specific membrane receptor protein. Okay, receptor protein of the receptor cell. By this what happens is activates G protein. When this G protein gets activated, there is activation of adenylate cyclase, okay, inside the cell, as a result of which there is formation of CAMP, that is cyclic adenosine monophosphate. And when this cyclic adenosine monophosphate is being formed, okay, it goes and attaches to the specific cation channels and it opens the cation channels, as a result of which there is influx of calcium ions. And opening of the calcium ions activates, okay, the chloride channels, as a result of which there is the potential that is being developed, and that potential is taken to the brain. So this is how you have to understand the physiology of olfaction. Odorant substances will bind to the receptor protein, it activates G protein, it activates adenyl cyclase, and then the CAMP. And when CAMP is activated, it opens calcium ions. Okay, opening of calcium ions, it activates even the chloride channels, as a result of which there is potential difference. Okay, influx of calcium, outflux of chloride, there is potential difference, as a result of which that potential difference is taken to the brain. That information is being taken. So now next is pathway. Okay, so where it is being taken. So this particular diagram, it gives a gross picture that where the from the olfactory mucosa it is taken to the olfactory bulb, olfactory tract, and finally to the areas. Okay, these are the main three locations. If you remember, it's fine. That is mucosa, olfactory bulb, olfactory tract, and finally olfactory center. So this is what you have to understand. So when you consider with the pathways here, next slide please. So olfactory receptors, whichever are there, they are being connected to the olfactory nerve. Okay, they end up in olfactory nerve, and olfactory nerve they end up in olfactory bulb. And this olfactory bulb is having two types of cells, that is mitral cells and tufted cells. Okay, so mitral cells they end up in medial fiber. Okay, and the tufted cells end up in intermediate as well as lateral fibers. Okay, and this particular mitral cell, whatever we say, which is end up in medial fibers, the axon move to the opposite side of the olfactory bulb. Okay, and the tufted, it may be intermediate or the lateral, they end up in olfactory tubercle and the olfactory cortex. Okay, so this you can consider as the olfactory pathway. Okay, next one. Applied physiology, only 3 points are there. That is anosmia, that is the total absence of smell, which we have, most of us, have gone through during the time of Corona. Total absence of smell, or else hyposmia. Okay, osmia is the term. If you put an means absence. If you put hypo means reduced. If you put para means altered. Okay, kind of this one. So this finish the total olfactory sense. So first one will be very simple. That is, you have to understand about the mucosa. Then you have to understand about the physiology. Then you have to understand about the pathway, and finally the applied. Okay. After that, the next one will be the gustatory sense. Okay. So in this, these are the points which you have to go through. You may have to go through the papilla first, taste buds and papilla. This we have to understand, and then the basic areas of taste perception you have to know, and the factors which influence the taste perception, and finally the pathway and applied physiology. So the olfactory and gustatory are somewhat easier. Only ear and eye. auditory sense and visual sense is little bit lengthier and little feels to be little complicated, but they are also simple enough. So next one, first we'll understand about the papillas. So whenever you will open, see your tongue in the mirror, whatever the elevations, beaded elevations that you see, they are nothing but the papillas. They are not taste buds. The elevations that you see over the tongue, they are papillas. This is first point, I want to make clear. The next one, next slide, this shows about the types of the papillas that are there. This is a simple diagram which you can use. The next slide, which gives a detail about the papillas. So the first one is circumvallate papilla. Okay, so they are 12 large papillas. 12 large papillas, okay, which is in circular form. Circum, you can understand, it is a circular form, and they are directly in front, parallel, okay, in front of that particular foramen cecum, okay, which separates the tongue into anterior 2/3 and posterior 1/3. Okay, it is inverted V-shaped, okay, manner it is arranged, and in each papilla, how many taste buds will be there? It will be around 100 to 300 taste buds are there in each of the papilla. So this is about the description. Means you have to first tell what is the shape of the circumvallate. In that you have to mention any papilla. It may be 4 papillas are there types. So in that you have to mention number 1 is what is the shape of the papilla, where it is located, how many are there, okay, and finally how many taste buds are there in each and its functions. That's it. So when you consider with the second variety, that is the fungiform, the word itself, it is like fungus or mushroom shaped, okay, location, it is scattered all over the tongue, okay, and how many taste buds are there in each of the papilla? 5 taste buds are there in each of the papilla. So this is about the second one, fungiform, okay. The next, okay, is a foliate papilla. Folia means very clear that it is leaf-like. Okay, so it is located on the either sides of the tongue. Okay, just beside that particular row of circumvallate. Okay, and this particular papilla very much important. That is the taste buds gets degenerated in the early childhood itself. Okay, this is the feature. Okay, next one filiform, which is nothing but thread-like. Okay, so they are mostly present in the tongue throughout the tongue, but the most important thing is they are responsible for, they are having tactile receptors, touch receptors. They don't have any role in the taste. It is not having any taste buds or something like that to make a proper bolus, to have a proper mechanical friction. For that and even for tactile reception it is useful. So this point is also very much important, like MCQ if it is turned, you have among the following which type of papilla is not having role in taste perception. So filiform is the one. So this also you have to remember, which can be considered under the MCQ also. Okay. So next one, we have to consider that. See, this is how the taste buds are being located. So if you have a section of the circumvallate papilla, okay, then you can clearly see that you are having a particular pore. Okay, and perpendicular that pore you have taste buds. Okay, so papilla you have taste pore, perpendicular to that you have taste buds. Okay, now what are these taste buds? What does it comprise? Next slide, it gives a clear-cut picture that it is having 3 kinds of cell. How we understood in the olfactory mucosa, same. 3 types of cells are there. Receptor cell, it receives the impulses, but here it is chemical and taste. Supporting cell, it gives anatomical support and the physiological support, both. And stem cells, which may get converted if for long time it is needed if there is any injury to the receptor cell. That's it. So this is you can consider like if you see the shape also in the textbook also it is mentioned, it is like a bunch of onion or garlic, like that it looks. Okay, so this is about the taste buds. Next one is the basic taste perception areas. So this image, if you remember, because I feel strongly that visual memory is stronger than the auditory. So if you have this particular image, then definitely you can remember tip of the tongue. Okay, you have sweet taste perception area. Sweet taste is most perceived in the tip of the tongue. Okay, tip and the sides a bit. You have salt. Okay, lateral aspects in the middle. Okay, you have sour, and finally bitter in the posterior aspect. We can consider 4 basic taste. Okay, next one is with regards to the substances which are responsible. So any substances which is having H plus ion, that is the one which makes the taste sour. HCl, you can understand, no? Citric acid, it is acid, H plus. So like that. And salt. Salt is perceived as salt because it is having Na plus ion. Okay, and bitter with calcium. And sugar always, it leads to, it is, that it is having glucose, but it leads to the closing of potassium channels, as a result of which it is perceived as a sweet. Sweet as perceived sweet because it closes potassium ions, and that potassium ions closure, it happens at different levels with different substances. That is why you will feel different kind of sweetness. Okay, so that is what the percentage of sodium ions or potassium ions, sorry, hydrogen ions or calcium ions whatsoever, how much it channelizes in opening or closure. Correct. So salt and bitter, it helps in opening H plus, Na plus, and Ca plus 2. Sour also you have different gradations. Salt also you have different gradations, even bitter. So as per that, it has to be categorized. 1 minute. So when you consider with the factors which influences the taste, definitely whenever you consider with the area, okay, it is inversely proportional. Means more the area, less the taste perceived. Okay, because number of taste buds are same, it is not going to change. But because of muscle or because of mucosa, if the tongue is bigger, okay, then definitely it will be inversely proportional. Then the apt temperature, which can be perceived by better taste, is 30 to 40 degrees Celsius. And definitely it depends upon the individual also. And adaptation is very, very important. No, whenever we consider that, a person getting, even acceptance and rejection, this also psychological factor also counts. Correct. For you are always having in home, suddenly come to hostel, getting adapted to that particular food variations. Person to person, it is going to vary. Some person gets adopted very fast, some person will take more time, some person will not get adopted at all. So that particular variations are also to be considered. And even psychological acceptance and rejections, I don't like sweet, I don't like sour, I don't like spicy, all these points is going to be considered. Okay, so the next point, very very important, that is gustatory pathway. So very simple, you know that tongue is supplied by two cranial nerves. Anterior two-third is by the facial, and the posterior one-third is by the glossopharyngeal. So the two nerves merge together and become one. One means solitary, one. So two nerves become one inside the CNS, and it is called as tractus. You know that group of axons outside the CNS, it is called nerve, whereas group of axons inside the CNS, it is called tract. So the two nerves join together. The two nerves, they join together and become one. Okay, and nerve inside the CNS, it enters the CNS. So it is not called as nerve now. Facial nerve and glossopharyngeal nerve, two nerves, they join together at the level of central nervous system. Okay, and they become tract. And the name is two nerves becoming one. Tractus solitarius. Very simple. And they end up in nucleus of tractus solitarius. Nucleus, you know that it is the bunch of cell bodies inside the CNS. The bunch of cell bodies outside the CNS is ganglion. Inside the CNS, it is nucleus. So they end up in the nucleus. After that, they cross over. First, they merge. After that, crossover. Okay, where they cross over? They cross over to the thalamus, and from the thalamus, they reach operculo-insular area. So olfactory also we have understood that it ends up in the brain. That is olfactory cortex. It may be olfactory tubercle. It may be. All these are in the base of the brain. Okay, olfactory areas is there in the base of the brain, whereas this gustatory areas, they are present in the parietal lobe. Okay, facial nerve and glossopharyngeal nerve merge together becomes one, moves as tractus solitarius, and they end up in a nucleus of tractus solitarius, and then they cross over, crosses over to the opposite side thalamus, and from there they will end up in parietal lobe, that is operculo-insular area. Very simple. And the last point here comes also is applied physiology. The term used is juicia. Okay, ajuicia refers to absence of taste perception. Then hypojuicia refers to diminished taste perception, and dysjuicia refers to disturbed, altered, taste perception. So by this we have finished the two sense organs, which are very simple, very basic, and very easy to understand. That is olfactory sense as well as gustatory sense. Okay. The next one is auditory sense. So here, the physiological and anatomical understanding is more. Okay, means functional anatomy of the ear. Okay, in the form of external ear, middle ear, and internal ear. and then you should understand about directly about the pathway. Okay, and if you want, you can remember about the deafness as such. So when you consider about the parts of the ear anatomy, then it can be categorized into three, as external ear, middle ear, and internal ear. And tympanic membrane is that particular structure which separates the external ear and the middle ear. And oval window is that particular structure which separates the middle ear and the internal ear. Okay, so this particular slide is very much clear. It becomes very much easier to understand. Okay, next one. So this is a basic diagram which you are going to get about this one, about the ear. So grossly you should be able to, it is not artistic, but schematic you should be able to draw this. Each and every part you will understand when we will go through the functional anatomy of each part. Okay, so the next one please. So the first one, that is external ear, in which we have to understand a bit of ear lobule, that is pinna, as well as external auditory canal. So this is here you have to strategically you have to understand that ear pinna, this particular auricle. Okay, it is main function is what function is to grasp the sound. That's it. Okay, it will grasp the sound, and that is the main point. And finally, understanding the parts of this. Okay, you have the superior most outermost part is helix. Okay, of the ear. If you see the outermost part is helix, and opposite to that you have an elevation that is anti-helix. Okay, like that in the diagram you can clearly see. You can name certain parts. It's not that all the parts you have to name. Helix, anti-helix, tragus, anti-tragus. Okay, like this, you can remember some 4 to 5 names and name them. That's it. Okay, schematically you have to draw a name. And then the next one is external auditory canal or meatus. So very clear that it is, it is a S-shaped and it is divided into two parts: the cartilaginous part and the bony part. The cartilaginous part, the length is 8 mm, whereas the bony one it is 16 mm, double 8 and 16 measurement in mm. Okay, the cartilaginous part, it may have hair follicle, it may have sebaceous gland, it may have ceruminous glands. The secretions of both sebaceous and ceruminous. Okay, there is spelling mistake there. It should be ceruminous. Okay, and this together forms earwax. Whereas the bony part, it is mainly formed by the squamous as well as the tympanic part of the temporal bone. Okay, next one is we'll move on to the middle ear. So where that external ear and middle ear, it is being separated by the tympanic membrane. Okay, so middle ear is also called as the tympanic cavity. These are the parts, that is the tympanic membrane, ear ossicles. Okay, then muscles are there, and eustachian tube. Fine. So let us understand first about the tympanic membrane. So it is a very thin membrane. Okay, it forms a boundary. You know that it is the one which separates the external ear and middle ear. That only you have to add as a sentence. Okay, and handle of malleus. You know, 3 ear ossicles are there. That is malleus, incus, and stapes. So the handle of the malleus, it is like a hammer-shaped malleus. So handle of that, it is attached to the tympanic membrane. Okay, and what tympanic membrane does? That is very very important physiologically. We have told that ear pinna, it grasps the sound. What does external auditory canal does? It transmits the sound waves. Now what does tympanic membrane will do? It responds or it vibrates to the sounds, means it converts the sound energy into mechanical energy or mechanical vibrations. That is what is done by the tympanic membrane functions. Okay, the next one is the ear ossicles. As you know that it is malleus, incus, and stapes. They are the smallest bones which are present in the body. Okay, and they act as a lever system, means it holds both. That is, one side you can see that is there is your membrane, tympanic membrane. On the other side you have oval window. So in between these two, it acts as a lever system. Okay, and this ear ossicles, in one end and the other end, it is holded by the muscles. Okay, next slide please, where you can see that two types of muscles are there. Okay, that is tensor tympani, which is directly attached to the tympanic membrane, or you can say the handle of medius, near to that it is attached. And stapedius, it is attached to the footplate of stapes near to the oval window. So you have 3 bones, and the two first one and last one, it is held together. Okay, by these two muscle. One is which is attached to tympanic membrane is tensor tympani, and which is attached to the stapes, it is stapedius. So it is holding that. If there is any high energy intensity sounds, okay, to decrease the intensity of vibration, you need the opposing force. For that, this is there to withstand that high intensity vibrations. And definitely, whenever you consider with the eustachian tube, then you know that it is helping in maintaining the pressure, whereas it is not having any role in the hearing process. Okay, so usually, normally, it is closed, except during yawning as well as swallowing. Okay, and the main function is equalizing the pressure. It is having relation with the nasal cavity as well as the oral cavity as such. So the last and the most important part is the inner ear, where the inner ear can be understood under labyrinth. And the labyrinth, it can be categorized under two: the outer shell, that is a bony one, and the membranous, okay, which is the inside. And inside one, you can consider that these are the parts. One is semicircular canals, then you have vestibule, and you have cochlea. Okay, cochlea, you know that it is a snail shaped 3.5 coil. I mean, say semicircular, like three rings which are perpendicular to each other. And between these two connections, three rings and snail, in between these two connection is the vestibule. In that, you have again two parts as utricle and secule. Okay, so the next part here you have to understand, this is the diagram. Okay, so the perpendicular three, whatever you see, bigger one, which are perpendicular to each other, they are semicircular canals. And the snail shaped whatever coil you see, okay, you have to consider it as cochlea. And in between the connection is the vestibule, which has again utricle and secule. Okay, next one, please. So when you uncoil this particular cochlea, okay, the snail shaped or whatever it is that, if you uncoil it, then this is what you are going to see. Okay, next slide will give a clear cut understanding. So we have told that steps, it is attached to the oval window. So you can see the oval window above, and scala vestibuli. Okay, the pink one is scala media, and then scala tympani. Okay, so the whatever the gray one is there, it is filled with perilymph, and the pink one, it is filled with endolymph. Okay, so whenever you consider with the movement of the vibrations, whatever the vibrations are there from the stapes, it will be reaching to the scala vestibuli, and you can see the arrow mark there. It is even going to the scala media. Okay, and the membrane which separates the scala media and tympani, on that you have the receptors. How we have olfactory receptors in the olfactory mucosa, how you have taste buds in the inside the papilla, like that you have receptors just above the membrane separating scala media and scala tympani, and that total particular unit is called as organ of Corti. Okay, next slide, please. So this is particular organ of Corti. Okay, you have basilar membrane, that is what I told, which separates the media and tympani, and on that you have organ of Corti. Okay, on the above, it is having different varieties of cells. That and all you don't need. Okay, and above the organ of Corti cells, you have one more membrane. Okay, that is tectorial membrane. So whenever the sound waves come, this membrane also gets vibrated, and that particular vibrations, the mechanical energy, it is being perceived by the hair cells, the receptor cells, converted to electrical potentials. This is what happens. The energy is being converted. The sound energy is converted to mechanical, then the mechanical is connected to electrical, and then it is taken to the brain through the neurotransmitters. So this is what it happens. So here also through this particular. So here it is organ of Corti. Okay. Next one, when you consider with the auditory pathway, for this mnemonic you can remember OT, MI, and MT. Means I usually say that to remember this particular thing, there is a patient in OT, operation theater, suffering from MI, that is myocardial infarction, taking MT, means myocardial treatment. OT, MI, and MT. So O for organ of Corti, okay, T for trapezoid body. Then in almost all the sensory pathways you have, this one midbrain. Okay, after that inferior colliculus, inferior MI for inferior colliculus, then medial geniculate body for one more M, and last one T is temporal lobe. Okay, so by this we have to understand that olfactory pathway is in the base of the brain. Okay, ends in base of the brain. Okay, then gustatory pathway ends in parietal lobe, whereas auditory pathway ends in temporal, the side just to the ear only, beside the ear only, temporal lobe. And here you have to remember that areas, that is 41 42 is primary area, whereas 21 22 is secondary. So like this, if you remember OT, MI, and MT, okay, organ of Corti, trapezoid body, then midbrain and inferior colliculus, and MT, medial geniculate body and temporal lobe. In that 41-42 is primary area and 21-22 is secondary area. So this completes the auditory pathway. And definitely, when you consider with these aspects, you can include deafness, okay, or hearing disturbances, any foreign bodies impacted in your ear, okay, or else congenital absence of the pinna. There is some injury or some disruption of the tympanic membrane. All this becomes applied part that can be definitely included. Okay. Then the last one, Sarvendriyanam Nayanam Pradhanam. So that is visual sense, we will understand. And the topic, the subheadings are very simple. Topic is a little bit faster, but headings, if you consider, then functional anatomy, optic pathway, and applied physiology. Applied physiology, all of you are very much well versed because we are understanding this particular regarding eye. It may be hypermetropia, or ametropia, etc. All those things, you are knowing it from the class 12. That is the applied physiology part. Anyways, so let us understand the functional anatomy first. Okay, so first point comes is eye is a specialized organ of sense of sight. Okay, this particular is the opening statement. Then the human eyeball is a hollow spherical structure. Okay, it is a hollow structure and it is spherical. That's very, very important. And the diameter of that is around 24 mm. And where it is located in the orbital cavity. So this 4 to 5 statements, you can convert this 3 into 4 to 5, and they are very simple opening statements. You can consider it as an introduction. Okay, the next one, how to understand the layers of this eyeball. Okay, so when you consider with the layers, then first layer comes is fibrous coat, fiber, then muscle, and finally nervous. So how to understand divisions in the fibrous coat? CSF. C means cornea, S means sclera. 1/6 part is cornea, 5/6 part is sclera, forms F. F means fibrous coat. Okay. Whereas the parts of the muscular coat can be understood as, under CCIM, means there was apex body earlier has CCIM. So C for choroid, okay, then another C, ciliary body, then iris, totally forms a muscular coat. Okay, and last one is the nervous coat, that is retina. Okay, and commonly the diagram which is there beside that can be included. Okay, the next one is the sclera. Okay, this particular diagram. Anyways, the sclera. So brief descriptions, you always remember that one particular point, just deviating, but still it's very important. Whenever you are writing for the exam, always remember that don't write sentences or paragraphs. Nobody is having the patience to go through all the sentences and paragraphs. Your impression goes down. So always use points with minimal words, not more than 2 lines if you're writing points. And use maximum flowcharts, schematic representation, tables, etc. etc. Okay. And even this is very much useful because whenever you see there are many, especially boys, okay, who are struggling with their presentation skills, means especially with their handwriting. Okay, see, always remember when you write more on the paper, okay, if you are having a bad handwriting, it looks worst. So try to write minimal. I'm not telling that you reduce the total thing. I'm not telling like that. I'm telling present well, write whatever things are there to what you want to convey, but in the form of table or in the form of chart. So when you write minimal words, okay, sclera, if you write 5/6 of the eyeball, that much, if sentence is 2 words, it is going to describe made of fibrous tissue, made of aroma fibrous tissue. Correct. So like this, if you make, then it becomes very much easier. And major functions, if you see, protects the content. May obviously it is outermost layer, it protects the content. Next, gives shape, attachment to muscles. Like this, if you write only two words at a time, even though if your handwriting is bad, okay, it looks little bit neat. That's what I feel. Okay, this is what suggestion I'm giving as per the student's perspective to improve their presentation skills. So, anyways, when you consider with the sclera, then definitely it forms 5/6. We have dealt in the previous slide, and it is made up of fibrous tissue because it is forming the fibrous part. And one more point you have to remember is the part where sclera and cornea joins. Okay, that is called as a sclerocorneal junction. Okay, which is also called as limbus. Okay, below that you have canal of Slem through which aqueous humor is drained. That is very, very important. Okay, and the total sclera is not uniform in thickness. Wherever there is muscle insertion, it is very thin. And even where the optic nerve goes out, okay, which is having net shaped, okay, so lamina fibrosa we say, okay, then it is very thin or net shaped. And if you consider the function, protection is a main function. It gives the shape also, and most important, it helps in the attachment of various muscles, extraocular muscles, means the muscles which are outside the eye, because these extraocular muscles are very much important for the movement of the eye. That's it, eyeball. Next one, where you have to consider with the cornea. Cornea, you have understood that it is a very transparent layer. It is having three layers: epithelium, endothelium. In between, you have stroma. That's it. Okay. So epithelium, it it prevents from the microorganisms, and the stroma, it transmits the light. Endothelium, it takes the nourishment from the from the deep inner aqueous humor, etc. It maintains the hydration of the stroma itself. Okay, and the oxygen is directly taken from the atmosphere itself, and the 75% of the refraction is by the cornea. Main function is that it transmits the light, and refraction up to 75%, I think, refractive index. So on that basis, 75% of the refraction is happening in the cornea. Okay, so next one, uh, where you have next sclera cornea, and the next one is the muscular port, where you have to understand choroid. Okay, so posteriorly it separates the sclera and the retina. Okay, it is having again four layers. Okay, the detailed description of that is not needed. And the oxygen and nutrition it takes from the outer layer of the retina, and the main function of it, it prevents the inner reflection and the scattering of the light. Whatever light is being coming, okay, it should directly go and focus into the retina. Okay, so that the image is properly formed. That is the main function. Okay, next one. Is the ciliary body. So whatever you see, the brown shaped, okay, it is having ciliary body. It is having two parts. Okay, number one is ciliary muscles. Okay, I can't point it out here. Okay, so ciliary muscles. Okay, you can see in the image, and ciliary process. You can see which are the ridges, etc. Okay, so next one, where next slide, please. Where you have the description about the ciliary body. It is triangular in shape. Okay. Scleral surface, towards the sclera surface, the muscles are present. Whereas the vitreous surface, towards the vitreous, towards the inside. Okay. It is smooth. Okay. Posteriorly, whereas anteriorly, towards the front, it is having many ridges, and it is in the form of process. Okay. And the main function of the ciliary process is the production of the aqueous humor, and most important is it helps in accommodation. Okay, means proper retinal light exposure for that particular thing, contraction, relaxation, etc., etc., for accommodation, near, close, etc., for that it will be helpful with the regards to light also. Next one, uh, next is iris. You know that, which we see the color. Okay, so the black part or brown whatsoever, depending upon this one, it will be different colors, blue, green, etc., depending upon the melanin pigments. Okay, and even it is having sphincter pupillae and dilator pupillae. You know that whenever light is being put, it dilates, and whenever it is far, okay, then or whenever it is darker, it dilates. So that particular thing to be understood, and mainly it controls the light rays. Okay, and the accommodation is by the pupil. That's what, near, far, etc. Okay, if you want to see something far, okay, then it gets dilated. Whenever you want to see something near, then it gets contracted. So that's what it does. Okay, and even it prevents intraocular light scattering. Okay, and color, you know that it is commonly from brown to blue as per the melanin pigments. Okay, next one, please. So these are the the layers of the retina. Okay, 10 retinal layers are there. Okay, it may be the layer of a pigment epithelium. After that, you have the layer of the receptors. Okay, after that, you have outer limiting, inner limiting membrane. Like that, in between, you have 6 to 7 layers that has to be by hearted. Okay, next one. So this is very simple, rods and cones. Okay, how a neuron is like that only. It is having dendrites, which is the receiving end. It is having the cell body, and finally it is having axon also, which takes the impulses towards the brain. Okay, next one. Here you should understand with regards to what are the similarities, or sorry, what are the differences between rods and cones. So the rods, it is number is more than 100 million, whereas cones the number is around 6 to 7 million. The roads, it is having a chemical known as rhodopsin. Okay, whereas cones is having iodopsin. Okay, roads are very sensitive and respond to even to the dim light. Okay, whereas sensitivity wise, cones are very less sensitive and they respond only to the bright light. Okay, so roads, we can say that they are responsible for the night vision and even peripheral vision, sideways, whereas cones, they are responsible for day vision and the central, which is in the middle. Okay, and movement detection is mainly by the rods. Okay, and the color detection is mainly by the cones. And adaptation, it is a little bit slower in case of roads and it's very rapid in case of cones. Next one, here you have the image of how the aqueous humor is being formed from the ciliary process, which the average formation is around 2 to 3 microliters per minute, and from the posterior section, okay, it goes towards the anterior section, and through the trabecular meshwork, okay, it gets going to the canal of Schlemm, which is called a sclerocorneal junction we discussed earlier. And the aqueous humor, the main contents are glucose, oxygen, amino acids, and even ascorbic acid. Okay, next one. So vitreous humor, which is there in the posterior part of the eyeball after the lens. Okay, so here it is once formed in the lifetime, it will be retaining like that only. So there is again no again and again repetitive no formation and drainage is there. It mainly is a gelatinous mass. It is having water, collagen fibers. Okay, and elongated proteoglycan molecules it is having, and it gives a proper size and shape to the eyeball also, cushioning effect too, and it prevents the detachment of the retina also. It keeps the retina intact. That is also one of the most important function of the vitreous humor. It prevents retinal detachment. Okay, so this is about the aqueous humor as well as the vitreous humor. Next one. So the most important point is the olfactory pathway. Okay, so one technique you can remember here is 2-1-2-1. Okay, means two retina. Okay, and it comes to one, that is optic chiasma. Then again two, it has to go, that is lateral geniculate body, LGB. Okay, and again one, that is occipital lobe or visual area, that is 17, 18, 19. Now what it, how it gets connected? 2-1-2-1. What is being connecting? NTR. NTR is a structure which connects this 2-1-2-1. Okay, means retina gets connected to the optic chiasma by optic nerve. Okay, from the retina, optic nerve comes out, and optic nerve comes together at optic chiasma. It crosses over. Okay, the medial fibers will be as it is. The lateral fibers get crossed. That is what it is happening. N. Okay, from optic chiasma, then it has to go to lateral geniculate body. It goes via optic tract, T. Okay, and from the lateral geniculate body, it goes to the occipital lobe, 17, 18, 19, via radiation in the form of rays. Okay, so 2-1-2-1, you can remember, two retina, one optic chiasma, two lateral geniculate body, one visual cortex or one visual area, that is 17, 18, 19 number. This are connected by NTR. Okay, N for nerve, T for tract, and R for radiation. Okay, then the last one here you have to understand is the applied physiology, which you are all expert from the PU level. Next slide, please. Where you have different kinds of visual problems, short sight, long sight, etc., etc., and its corrections. Okay, so myopia, it is said as short sight. Hypermetropia, it is long sight. Presbyopia, which is usually seen at the level of 40, at the age of 40 years, and astigmatism. Okay, so this kind of things along with its corrections. Okay, along with its corrections, where myopia is usually corrected using concave lens, hypermetropia by and presbyopia by the convex, astigmatism, okay, by the the cylindrical lens. And in the slide you can see that the explanations that what it is. Okay, means myopia means cannot see the distant object. Hypermetropia means cannot see nearer object, whereas presbyopia simply means it is loss of accommodation. Okay, and astigmatism means the light cannot be focused at one point. That is explanation of all these things, and even corrections is being told, and the reasons are there in the third column. So along with this, even sometimes even the physiology of accommodation, what happens when shift from day to night, You are going to the theater, okay, suddenly from light to dark, what happens? Physiology. And from the theater, you are coming out from dark to light. So all these things are being discussed in the majority of the physiology textbooks. Okay, if you are interested, definitely you can go through. But visual sense as such, if you cover this much points, it will be more than sufficient. Means the functional anatomy has such. Okay, then main is the pathway. Okay, main is the pathway. One page full you have to write the pathway. Okay, means see, whenever it comes for 10 marks, means 5 pages. So for the last 2 pages, one page is pathway, next page is applied physiology. Okay, and the 3 pages you have to write about the functional anatomy. It may be auditory sense or visual sense as such. Usually all olfactory and your gustatory, it comes very less for the 10 marks, but you never know. It depends. So you should be strategic enough to maintain. But all the information is you can include this much information. Whatever is being told, it can be replicated in the exams. Okay. So I think this is the last slide. Yeah, as such. So by this I have finished the topics that is allotted to me. That is Nidra, Swapna, okay, and Ojas, as well as special senses. Uh, it may be a little faster since I thought that it is in the YouTube. So the same videos, it can be seen once again and can be gone through. And definitely the PPTs, everything, it is available in the screen also. And even you can take it from the contact the organizers and collect it. Hope this one was very much helpful, especially to the students who are appearing for the exams. And one more point, which thing is which I feel is very much important, is that you can see that many images are being here in the thank you slide. You can see that about the textbooks. I just want to say that if you go to Google Play Store and you just type for Kriyasparsham, you are going to get an app. Okay, Android app. It is free. Just you have to accept terms and conditions and just download it. After that, it doesn't require any internet also. So it is having 5 sections. Even Ayurveda paper one, paper two, modern paper one, paper two, it is having even practicals, Prakriti, modern, everything it is having. Okay. I mean, if you want much more interested to understand deeper, for example, what is pranavas is, what is Brajaka Pitta, all those things, if you want to understand in physiological terms, that also for that also one separate section is there. So you can access it wherever you want. You can take the anyways, you take the mobile wherever you go. So for Android users, okay, so for that, you can access Kriyasparsham very easily. And for the benefit of the students, what I thought is that the main thing lacking in the Ayurveda curriculum, majority of the textbooks is images. So if you get a proper image to understand, okay, any of the term, okay, then it will be easier for if the person who is even finding it difficult to by heart the shloka. If he gets the image, then it will be better that it will be easier for him. At least he can enlist the points. Okay, so for that, I have come up with Suchitra Kriyashareera, one book which is self-published. I only have published it. Okay, which is around 100 to 102 pages. It is having all the concepts of Kriya, starting from Vata dosha till the Atma Lakshana. It is there. It is like a pocket book. Okay, pocket book. Okay, which can be even kept in your pocket, aramse wherever you want. You can carry. It is having only on the below you have shloka, and the total content it is having only image. Okay, only images. Vata guna means it is having only image. Ruksha lagu shita kara sukshma chana anila. This is the shloka. Ruksha, it is having image and its meaning, what it means, technical meaning. Okay, that is also very much important, which is actual meaning. It's not direct translatory meanings. Okay, so that the understanding becomes better. Okay, so these two things I want to tell, so that students will be benefited much more. So app definitely it is readily available. So even this particular book, if you are interested, you can contact me. I can do courier to you at any time. So again, once again, I'm doing my advertisement in between, and I'm very thankful for the organizers also for giving me this opportunity to share this particular informations. Since I was a little bit busy with the NCSM and Marbism works, a little bit was not able to make up with the slides. So I have used the older versions of the slides also, and from the PG scholars. Okay, but what's your hope? This was fruitful and students will take it positively. And this informations all the time it will be available in the YouTube. So definitely all the student fraternity will take benefit out of it. If you have any doubts with regards to any topic, see, all over India, whomsoever with regards to Kriya or Ayurveda, okay, to help them who are struggling with the subjects. I'm there, so you can contact freely at any time. Okay, and even if you type my name in the Google, you will get all the details, so you can contact me, right? Once again, thanking the organizers for this wonderful opportunity and wonderful platform, and they have created. First of all, when I heard about this organization detail in the starting of this particular video, I was very happy that current students are having this particular trend. They are teaming up, and networking is very much important so that you can develop the network. And it is not that central government, whatever the vision is having, sabka saath sabka vikas. So they are together. They are for some good cause. Okay, so when your academic and understanding becomes much more clearer. Okay, and I feel that throughout, it's not only during the exam time, even during the other time also, so little bit understanding of a clear cut understanding about some of the Ayurveda concepts. Okay, much more critical analysis, so that if that is being understood, then it will be much more clear for the students. If that videos, all the things are available in YouTube all the time, it will be more fruitful. That's what. Okay, right. Thank you.
Thank you, sir. Thank you so much. It's our privilege to host you in this session today. You have
Thank you.
given your great time for conducting session, sir, in spite of your busy schedule. On
Yeah,
behalf
of
of our
course. Again, I
Panchajanya
have to rush to college now.
organization,
I have work. Yes.
on behalf of our Panchajanya organization, we are very thankful to you, sir, for accepting our invitation.
Yes.
And this session will be definitely useful for the students, sir, who are preparing for upcoming exams. You have explained the
Yes.
concepts in very easy ways, sir, through various mnemonics and all, and along with exam tips
Yeah.
also. Thank you so much, sir.
Yes.
Thanks
Yes.
once again.
Yes. Yes. Thank you. Thank you. Thank you so much. Okay. Okay.
We'll wind up the session now, sir.
Yeah. Yeah. I will close the cam and mic. Yes.
Yes, sir.